Let's talk about a condition that you've probably heard of, but that's often really misunderstood: cerebral palsy. We're going to cut through all the complex medical jargon and give you a really clear guide on what it is, where it comes from, and how it's managed.
So, here's our game plan. We'll start with the absolute basics. Then we'll dive into the causes and the different types. After that, we'll look at how it's diagnosed, and finally wrap up with treatment and what the future can look like. So, let's jump right in. All right, first things first. What exactly are we talking about when we say cerebral palsy? You know, the name itself actually gives us a huge clue. Cerebral tells us it has to do with the brain, and palsy, that just means weakness or trouble with muscle control. So put it together, and cerebral palsy, or CP, is basically a group of disorders that affect a person's ability to move, to keep their balance, and to hold their posture. And it's all caused by damage to the brain while it's still developing.
Okay, this next point is absolutely crucial to understand. Cerebral palsy is what's called a non-progressive condition. What that means is the original injury to the brain doesn't get any worse over time. Now, the symptoms might change as a person gets older, but the root cause itself, that stays the same. That's a really fundamental piece of the puzzle.
So that naturally leads to the next big question, right? If it's caused by brain damage, well, how and when does that damage actually happen? Let's take a look.
Now, this right here, this surprises a lot of people. The huge majority of cases, we're talking about 80%, happen before the baby's even born. Only about 20% of the time does the injury happen during birth or very shortly after.
So what are some of these specific causes? Well, before birth, it could be a number of things. A lack of oxygen, an infection the mother has, or even genetic mutations. During the birth process, things like being born way too early or having a really low birth weight are major risk factors. And then, in some pretty rare cases, a bad infection or a head injury in early infancy can also be the cause.
Now, it's so important to know that CP isn't just one single thing. It's really a spectrum. It's usually broken down into 4 main types, and that's all based on what kind of movement problem a person is experiencing. And it turns out one type is way more common than all the others. Spastic cerebral palsy. This one accounts for a massive 70 to 80% of all cases. So let's start there. With spastic CP, the main thing you'll see is really stiff, tight muscles. The medical term is hypertonia, and it leads to movements that can look pretty jerky. Now contrast that with dyskinetic CP. Here, it's more about involuntary, uncontrolled movements, kind of twisting or writhing. That happens because their muscle tone is all over the place, going from way too tight to way too loose. And just to round out the picture, there's ataxic CP. This type mostly messes with balance and coordination, which causes movements to be shaky and unsteady. And finally, you have mixed CP, which is exactly what it sounds like. Someone has a combination of symptoms from 2 or more of the other types, very often a mix of spastic and dyskinetic.
Okay, so now that we know the different types, how do doctors actually identify the signs? Let's get into the common symptoms and how the whole diagnosis process works. The signs usually start to show up pretty early in childhood. I'd say the biggest one is a delay in hitting those motor milestones. You know, not sitting up or crawling when you'd expect them to. Other big signs can be unusual muscle tone, either super stiff or really floppy, or specific postures, like their legs scissoring when you pick them up. Trouble with feeding or even speech delays can also be clues.
Now, I want to pause here for a second, because this is a huge misconception we really need to clear up. Cerebral palsy is a motor disorder. It's about movement. And while some people with CP might have other challenges, many of them have completely normal intelligence. The physical challenges do not define how smart they are. So with all those potential signs in mind, how does a doctor actually put the pieces together and make a definitive diagnosis?
Well, it's not like there's one simple blood test for this. It's really a process. It all starts with closely watching a child's development. If there are red flags, a doctor will do a physical exam to check their muscle tone and reflexes. And then, the final step is often brain imaging, something like an MRI, which can actually show the damage in the brain and confirm everything. Once a diagnosis is made, doctors often use a system to classify how severe the CP is. It's called the Gross Motor Function Classification System, or GMFCS. And really, it just helps everyone understand the whole spectrum of mobility, all the way from level 1, where someone can walk without any issues, down to level V, for people who have severe limitations and need a lot of support. And that brings us to our final and honestly the most important section. With all this information, what does the road ahead look like? Let's talk about the toolkit that's available for managing CP and living a full life.
So let's be really clear about this. While there is no cure for cerebral palsy, that is absolutely not the end of the story. Not even close. The entire focus of treatment is on one thing: improving a person's function, helping them become more independent, and just maximizing their potential.
And this isn't a one-size-fits-all approach. It's a real team effort. The heart of it all is therapy: physical, occupational, and speech therapy. Then there are medications that can help manage things like muscle stiffness. Sometimes, surgery might be an option to correct joint issues. And of course, there's a whole world of incredible assistive devices, from braces and walkers to high-tech communication aids that help people navigate their world more easily. When you look at all the research, when you talk to all the experts, it all boils down to this one powerful idea. The sooner a child gets access to this toolkit of therapies and support, the better their long-term future looks. Early intervention. That is truly the key to unlocking a life with the greatest possible independence and quality of life.